the Capitol. The gentlewoman from Bedford, Ms. Byron.
Thank you, Mr. Speaker. I rise for a point of personal privilege.
The gentlewoman has the floor.
Thank you, Mr. Speaker. Ladies and gentlemen of the House, this is my 18th session here at the General Assembly. And I've heard a lot of speeches from this House floor. So I spent a lot of time in preparing the message that I was going to give today because I knew that, one, if I wanted you to grasp it, that I would need to try to keep your attention at the same time, too. So hopefully, at least for a couple minutes, I have your attention because this is an issue that I hope to leave you with a better understanding of. At 8:30 tomorrow morning, the House Committee on Health, Welfare, and Institutions will hold a public hearing on one of the most pressing issues facing Virginia's families today, and that's the rising cost of health care. As chairman of the Health Insurance Reform Commission, this is an issue about which I have heard an awful lot over the last several years. From monthly premiums that have risen far beyond what was promised when the Affordable Care Act was approved, to deductibles and out-of-pocket expenses for families. And next year, it'll be over $7,000 for one person out of pocket. The expense of health care has affected my constituents and the people of Virginia in a very big way. Things have changed dramatically with Obamacare. As we see more high-deductible health care plans, consumers are becoming more informed about the care they seek, where they seek it, and how much they pay for it. While the commission I chair has heard much about the problem of health care costs, solutions have been in much shorter supply. Last year, there were several bills to reform Virginia's COPN laws. We are not alone. Other states began debating their COPN, known as Certificate of Public Need, and news stories started regularly appearing about these laws and their effects on health care choices and costs. In studying these laws, the Mercatus Center at George Mason University concluded COPN laws limit competition, diminish access to care, and contribute to rising health care costs. They are not alone in reaching that conclusion. The Federal Trade Commission and the United States Department of Justice's Antitrust Division have both concluded that COPN laws limit consumer choice and stifle innovation. That is not a position they reached just recently either. The FTC told Virginia it supported the complete elimination of COPN laws 29 years ago in 1987. This is why they have urged states like Virginia to reconsider whether retaining these laws best serve their citizens' health care needs. Virginia adopted its COPN laws in 1973. At that time, the federal government began requiring states to adopt such regulations in an attempt to control the rising costs of health care. Back then, the federal government reimbursed providers on a cost-plus basis. You can guess what incentive that created. Build it, bill it, and get paid for it, plus a percentage of profit margin on top of that. Eventually, the federal government changed the way it reimbursed for health care, and in the early 1980s, it repealed the mandate that states have to have COPN laws. Why did the federal government do this? Because it realized that COPN laws were not controlling costs. Fast forward 30 years later, Virginia still has a robust COPN program on the books. The last time we had a significant debate about COPN was 16 years ago. This year, we have a real opportunity to reform a system that is not keeping up with the changing health care marketplace. When it comes to the debate over the Commonwealth Certificate of Public Need program, there are two main arguments made by the supporters of the existing law. First, preserve the status quo to ensure market dominance. Why wouldn't you want to preserve the status quo when you're the only game in town? When there's one game in town, that entity controls what it charges. When competition enters the market, prices fall and patients benefit. The second argument, charity care and cherry picking, which has been addressed in the bills coming forward, requiring the same charity care from all competitors. The situation stifling competition has become more serious, not less, over the last decade. Consider these developments. Independent imaging services are being bought and owned by hospitals. Physicians' practices are being bought and owned by hospitals. 2/3 of health insurance providers are owned by the hospitals. Centera owns Optima. Inova in Total Health and Innovation Health, which just did a joint venture with Aetna. VCU Health System owns Virginia Premier. And Centra in my region owns Piedmont Healthcare Plans. Not only do they receive the protection of COPN regulations, but as a payer, they don't experience the same challenges in negotiating with health plans. Rockefeller, Carnegie, and Morgan would fully understand this arrangement, and they would be envious. Because in this case, the monopoly is being provided with the assistance of government. We hear that hospitals are economic engines for our regions, and I definitely agree. Like any hospital, they and other providers should be allowed to deploy capital and put plans in place that are forward-thinking and long-term and not subjected to haphazard or inconsistent decisions made here in Richmond. But why do we have a system that allows such investments to be held hostage because two competing providers attempt to hold up each other's projects by opposing one another's applications and gaming the system? Government continues to protect their market share while they purchase more and more physician practices and reclassify them as outpatient facilities, which immediately triples the cost of the same services to the patients in your districts. It has another effect that is starting to concern local government. The accumulation of these properties by nonprofit hospitals are now tax exempt and removed from your local property tax revenues. So your patients have a larger share of tax liability to subsidize each of these deals as well. You might wonder why then, why has nothing been done to alleviate this expensive regulatory burden that thwarts competition, limits consumer choice, and stifles innovation? Well, just stop by tomorrow morning's hearing and you'll see why. There is no doubt in my mind that House Room D will be filled with and dominated by hospital employees, hospital administrators, doctors employed by hospitals, and an army of lobbyists being retained by the hospitals. They have every right to be there. Some of them are our friends. I am sure that whenever an effort is being made to bring real competition to any industry benefiting from a restricted market, everyone affiliated with the protected industry comes out in full force. But when you're looking around the committee room at all those attending that meeting to ensure their insulation from competition continues, I'd like you to think about those who are not there too. Think about your neighbor who could have received an MRI at a fraction of the cost from a facility other than that hospital. Think about your relative who might have been able to have an outpatient surgical procedure done at a significant savings by using an ambulatory surgery center. Think about a good friend who's battling cancer and their chemo treatments tripled because the hospital just purchased it and can now charge higher prices because they're an outpatient facility. Think about the independent doctors in your community who want to offer a lower cost treatment alternative to their patients, your neighbors, but have been thwarted by a system that requires tens of thousands of dollars just to overcome the regulatory hurdles associated with COPN. These are the people who have entrusted us to represent their best interests. They have not asked us to provide protection from favored firms at a higher price that they must bear. They are asking for any relief from the expense of a healthcare system that's largely uncompetitive and over-regulated. Our healthcare plan may insulate our wallets from the egregious expense of some services. Many of those we serve who have high deductibles and enormous out-of-pocket expenses are not so fortunate. The administrator of your local protected hospital may be one of your constituents, and a very well-compensated constituent at that. Your local hospital may employ hundreds more of your constituents who, despite support for their current employer, would also benefit from competition in their jobs. But in House Room D at 8:30 tomorrow morning, will the voices of all 80,000 of your constituents be equal in volume? Will the voices of those with limited health care choices be as loud as those who insist on preserving the very expensive status quo? As this debate continues, I ask all of you to hear the distant voices. Remember those who don't have the wherewithal to retain lobbyists or to take an unpaid holiday off from work to testify at a public hearing in Richmond. If we're ever going to alleviate their health care expenses, we must reform COPN, and we must act to reform it now. It'd be easy for us to say it's too complicated and, like my local hospital, support the status quo, but that's not in the best interest of the citizens in the region or in the Commonwealth. Admittedly, the healthcare industry is unique, both in the mandates government places on it and the economic protections like the COPN process bestowed on it. It seems to me that's all the more reason to find creative ways to increase access to healthcare for patients at a lower cost. There's nothing to prevent us from enacting responsible reform that protects charity care, and there is nothing other than pressure from the direct beneficiaries of this government protection to prevent us from making the long overdue changes that would increase consumer health care choice and lower health care costs. I realize I'm asking the members of this body to do something bold. Enacting changes to a system that's been in place for more than 40 years takes courage, but that's exactly what our constituents need. We don't need more studies. We've had plenty of those. We need action, and we need action now. We know what needs to be done. The American people are looking for elected leaders with the backbone and fortitude to fight for them and get things done. I ask all of you to join me and do just that. Thank you, Mr. Speaker.